Insemmu l-koħbib jibda issa l-program tagħna Malta l-lejla u bħalli għattilkom anka f'dik l-intervent qasir li għamilna ftit ilu. Nibdew mal-ewwel fil-kumpanija ta' Dr. Andrew. Llum magħna wara li għandna Dr. Andrew nsellmulu. We also have Christina, who is all the way from far away Sweden, joining us in this conversation. We're going to be discussing fibromyalgia. Obviously, Christina has this condition and was kind enough to accept to be here amongst us so that she can talk about her own experience. Like I said, Christina, before we started, I'll have to go from Maltese to English and English to Maltese occasionally. Din il-kondizzjoni forsi għadha mhux daqshekk rikonoxxuta. Hija kondizzjoni però li qiegħda tolqot ħafna nies u xek. Qiegħda tikber isa, sa jew għax qed tikber l-awareness tagħha, il-kuxjenza tagħha. Jew għax qed tikber ukoll bħala kondizzjoni nifisha.
Ifhem, jiena naħseb illi minn dejjem kien hemm każijiet tagħha din il-kundizzjoni u issa iktar qed isiru konxi t-tobba tagħha u anki n-nies u qed imorru għand it-tobba u qed isiru iktar diagnosis tagħha. Fejn qabel kienu jgħidu li kienu sintomi li ġejjin mill-moħħ, psychological, psychosomatic. U jgħidu li, per eżempju, mu veru xej li jtħoss.
Ġabu t-għu jgħidu du kif fissata, dajem tajt li marida.
Eżatt. U fil-fatt, il-ħagġa hija li meta jagħmlu t-testijiet ta' d-dem u ta' kollox ikun normali. U bekk isom fl-antik ma kienu jemmnu li kien hemm daw tat-tip ta' kundizzjoni għax as such provi kimiċi ma jkunx hemm fir-riżultati, allura hija xi ħaġa li il-pazjent qed jgħidlek x'qed iħoss u tittemmen lilu jekk ma temmnux.
Ma tasalx. Ħanaqra ittra li hija ftit forsi għal min huwa sensittiv, forsi marċi segwina għal ftit minuti ma nafx għax hija naqra realistika żejjed, ħanaqra din litra li kitbet ilna telespettatriċi. Kelli ħafna domanda biex nitkellmu dwar da suġġett. Però din litra li għażilna li propju nitkellmu naqrawilkom. Jiena Carmen għandi 40 sena. Il imbagħad bid-depression minn mindu kelli 19 sena. Ommi kienet talqet id-dar tagħna stess waqt li missierna kien ħadna naraw film għax ommi qatt ma riedet tiġi magħna. Meta tħalt id-dar mort nfittex l-ommi biex nirrakkontala x'rajna u sibta mdendla mit-taraġġ. Kelli 17 sena. Tista' taħseb kif impressjonajt ruħi u għadni lanqas nista' nneħħi din l-istampa tagħha minn quddiem għajnejja. Spiċċajt laqt mill-iskola waqaf nistudja, bdew jaqduni dwejja kbar. Kont nagħmel ġranet sħaf fis-sodda nibki. Wara ħafna missieri kien ħadni għand tabib u dan bdieni fuq xi pinnoli. Wara ftit bdejt inħossni ftit aħjar, iżda ma tantx domt. Beda jkolli uġeħ ta' rasijiet qawwijin, uġeħ f'sidri u anke uġeħ f'żaqqi. Spiċċajt għand professuri li qalli li kollox mid-depression ġej u żid li iktar pilloli. Alla volja kont nħu l-pilloli li ġeħ ma rridx jitlaq. Bdejt anke nħossu ġeħ fil-ġogi u fil-muskoli. U dan aktar ma jgħaddi żmien aktar beda jgrava. Mort għand 3 tobba, kollha jtuni l-pilloli tal-uġieħ u fl-aħħar irreferewni l-isptar għax ħasbu li għandi l-artrite. Għamlu li xeba testijiet tad-dem, X-rays u minn kollox. Kollox tajjeb kelli, laqqas stajt nemmen. Imbagħad batuni għand professur ieħor tar-rumatiżmu u qalli li għandi il-fibromyalgia. Beda jtini pilloli għaljin ħafna u l-ġieħ beda jtaffi. Issa ninstab mhux ħażina grazzja talla. Nixtieq nagħmel appell il-kull min iħoss dan l-ġieħ fil-muskoli u fil-ġogi biex imur għand it-tabib għax din il-kondizzjoni tista' tiġi kontrollata u mhux vera li kollu mill-moħħ ikun ġej. Itra fimni għanda storja unek history xejn faċli u allura jiena l-ewwel ħaġa nistaqsik hija din il-history tagħha illi forsi kkaġunata l-fibromyalgia jew m'hemm l-ebda link li tassoċja okkażjoni bħal di mal-kondizzjoni.
Le, link ikun hemm għax fem mhix klassifikata bħal kundizzjonijiet oħra li nafu pereżempju li hija xi ħaġa li ġejja bħal semmejna autoimmune jew ġejja għax il-frixa ma taħdimx sew. Din hija combination ta' psychological u physical. Jiġifieri, as such il-changes li jkun hemm ikunu fil-moħħ. U ħafna drabi isiru daw il-changes minħabba jew ikun hemm xi incident traumatiku, bħal per eżempju kont qed nitkellem ma' Kristina she was involved in a motor vehicle accident more than once, which could have triggered it off. F'dal-każ kien l-istress li speċi rat l-omma f'dak l-istat u ovvjament baqgħet impressjonata, imma l-istress huwa kaġun dokumentat li jista' jwassal biex toħroġ il-kondizzjoni. Jista' jiggrava u anki tista' toħroġ.
Minn hekk.
Jista' jkun li tibda minn depression u mbagħad tipprogressa kif tal-każ ukoll li dik il-persuna tħoss uġijat fil-ġogi u fil-muskoli kullimkien u jista' jkun li ma tkunx assoċjata mad depression. Hemm tipi differenti li jkunu
skont il-gravità wkoll probabbilment.
Eżatt. Jista' jkun li tibda biha u mbagħad toħroġ id-depression wara għax dak li jkun muġuħ u speċi mbagħad jiġi depressed. Imma ħafna drabi jkunu assoċjati ma' xulxin, però l-inċidenza tagħha il-kundizzjoni hija 2% fil-popolazzjoni, ġifieri hija pjuttost.
U iktar fin-nisa milli fir-irġiel?
9:1.
Immarelli, okay. Differenza.
Ġifieri l-maġġoranza huma n-nisa.
Okay. Christina, once again I thank you for being here. I really appreciate the effort you made. Can you tell us your story, how you got diagnosed, how you realized that you have this condition?
I got diagnosed 5-6 years ago, and I have gone many times to the doctor, tried to tell them that I have pain in the body everywhere, and they were not taking it seriously.
What kind of pain? Because for someone who's watching us, how can I understand what kind of pain you feel?
It's a burning pain.
Burning pain.
Burning pain, and you feel very tired in the body. Okay. You can't do things, and you're weak in the limbs. And for my case, it's a lot of burning everywhere, and if people touches me, I feel big pain, even if they don't touch me very hard.
Okay.
So
sensitive all over, kind of.
Yes, and you wake up with pain and you go to bed with pain. You walk with pain and you sleep with pain.
And how long had this been going on before you actually got diagnosed?
Since the 90s.
My God, so that's over 20 years.
Yeah. So you have a problem to sleep. You try to move in a good position in the bed, and sometimes you got a good position, and sometimes you don't. So you need sometimes to have help with medicine. So.
And you were obviously prescribed different medications throughout this, but never for fibromyalgia. They never acknowledged that.
No,
this could be the
not until 5-6 years ago. There was by a coincidence. There was at my health center. There was a lot of doctors moving, coming and going all the time. And by chance, for some months, there was an expert, and I was coming once more time with my pain, and she said, "Okay, I have a look at because I have so much pain in the hands also now. It's starting to get worse." And she said, she did investigate me by the way you check up if you have fibromyalgia, and she said to me, "You have one good news for you and one bad news for you." I said, "Okay, what's the good news?" I said, "I know what it is." "Oh, what is it?" "Fibromyalgia." "Okay, the bad news, you have to live with it." I was like, "Oh no." So you have to take medication for it, she says.
But since you've been diagnosed these last 5-6 years, have you seen an improvement?
Yes, it's less pain, but I'm still limited, and I'm also retired nowadays. Okay. I don't work anymore.
Okay. But not due to the condition, it's obviously...
No, it's one of the conditions.
It's one of the conditions.
Yes.
You decided that you cannot take it anymore.
No, the doctor also, and everyone says that this is enough for you. You can't work because you get very frustrated also that you can't lift up things, you can't do things. And I was very, very active, and I got very high position on the work also. And suddenly I was like feeling like an idiot because I can't do things, and you get depressed by it also.
Throughout the time when you had not been diagnosed yet, were there ever days when you felt that people were looking at you weirdly, that they were saying, "Oh, she's paranoid, it's not true, she's not sick, it's because she's inventing
It's in the mind," they said. And also the doctor said, "But it's psychosomatic, it's not real pain you have." It's not. It is very hard in Sweden to get the recognized as a disease, and also to get the right diagnosis. Because we have a saying in Sweden that is burning, aching, and old lady thing. So when we're coming
yes.
with the thing, they said they're just ignoring you because now this is not a real disease. And then you go home with a stick and feel pain again, and that's it. You get more some medicine, paracetamol or something like that, but you don't get any help. And to the end, you get very, very frustrated and angry and depressed.
And that's obviously, it's like a vicious circle.
Yes.
The depression would obviously increase the pain.
Yes, and you don't sleep, and then you get tired, and you go up in the morning.
It obviously affects even the people around you, because
yes,
I'm
because
sure there are days when you're not a nice person to be around.
No, it was like a pit bull terrier sometimes in the morning, and I will continue to be the pit bull terrier.
Okay.
So everyone says I've been much better since I started to take medicine. So it calmed down the situation. So.
Okay.
And also have the diagnosis was a relief, because then you at least have someone that believe you that this
it's
is
recognized.
Yes.
No, I'm not insane. I'm actually.
Yes, I'm not crazy one.
I actually do have something. I mean, I am really understanding you, because someone close to me went through this for many years. So, in a way, I'm so pleased that you're bringing this across, and we are making more people aware of the situation, because it still exists that some people who are perhaps not diagnosed would still be treated like, you know, the invalid, and they say, oh, because she's always, you know, complaining about the pain here and then whining about it. And it's not easy. It's not easy at all. Excuse me, I'm going to go to Maltese again so everyone can understand us. Bħal ismajtu, Kristina kienet tajdinna dwar l-esperjenza tagħha li għamlet prattikament iktar minn 20 sena, 25 sena, illi kulħadd itija mediċina differenti, kulħadd jgħidilha speċi ma jafx għandha, kulħadd finalment 6 snin ilu marret kienet qiegħda ġewwa klinika kien hemm qed nitkellmu dwar l-Iżvezja hawnhekk kien hemm persuna illi kienet propju speċjalista fuq dan u sabet illi għandha din il-kondizzjoni fibromyalgia li qegħdin nitkellmu dwarha. Hija iddiskrivita bħala ħruq, sensazzjoni ta' ħruq u anka sensitività kbira, ġifieri jekk inti tmissa tweġġa'. Saħna qegħdin nippruvaw nagħmlu dil-konverzazzjoni ma' flimkien ma' Dr. Andrew biex inqajmu anka kuxjenza dwar din il-kondizzjoni, għaliex nemmen Andrew li hemm nies hemm barra illi qegħdin ibatu u ma jafux illi din teżisti. Huwa t-tabib il-GP huwa t-tabib tal-familja li jista' jara din il-marda jew huwa psikjatra jew huwa persuna tar-rewmatiżmu. Ant min għandek tmur?
Normalment it-tabib tal-familja huwa l-ewwel persuna li xi ħadd imur għandu, jiġifieri aħna naraw kollox hu bażikament. U mbagħad ovvjament hawn min jaqbad u jirreferi u hawn min speċi jagħmel it-testijiet bażiċi biex jara jekk hemm ħafna mis-sintomi joverlappjaw ma' kundizzjonijiet oħra. Allura t-tabib jagħmel dak li ngħidulu differential diagnosis, jiġifieri ikollu lista ta' kundizzjonijiet f'moħħu u jibda jeskludi waħda, ġifieri jekk pereżempju qed jaħseb rheumatoid arthritis jagħmel it-test pereżempju tad-demm, jekk qed jaħseb xi kundizzjoni.
Ħafna min nies jassoċjawha ma' l-uġigħ tal-arthritis u xejn.
Għax huwa uġigħ pjuttost simili, mhux eżatt, imma huwa uġigħ musculoskeletal, u jiġifieri mill-skeleton, mill-muskoli u mill-għadam. Jiġifieri daw it-tip ta' kundizzjonijiet ħafna drabi huma simili ħafna, ġifieri u hemm kundizzjonijiet oħra li jiġu excluded bit-testijiet tad-demm, ġili pereżempju jsiru xi X-rays jew MRIs, jekk pereżempju jinnaf jaħseb it-tabib li hemm xi fjammazzjoni fil-ġogi, etc. U meta it-testijiet isiru u ma jirriżulta, ma joħroġ xejn bħala riżultat, mbagħad iċ-chances huma li hemm dil-kundizzjoni. Issa mbagħad ovvjament hemm professuri li jkunu fuq dawn l-affarijiet li daw il-pazjenti jiġu referuti u toħroġ il-diagnosis konfermata ta' fibromyalgia li mbagħad hemm mediċini apposta għalija li jistgħu itaffu l-uġigħ u anke dik il-persuna tħoss aħjar, tkun tista' tiffunzjona aħjar u hemm diversi degrees u grades tagħha, ġifieri hemm min ikun mhux daqshekk gravi u hemm min ikun iktar avvanzatu. Però mediċini jeżistu, ġifieri jekk persuna kuljum qed tkun muġuha u minħabba l-uġigħ hija limitata fl-affarijiet li tagħmel kif semmit anki xogħol u dawn l-affarijiet. tista' tieħu mediċina biex tkun aħjar u tgħix il-kwalità tal-ħajja tkun ħafna aħjar.
In fact, we're saying that once you start the medication, the quality of life improves.
Yes.
It doesn't become 100%, but it improves. And like that, it gives you the possibility of living a relatively decent life rather than being in pain and crippled all the time. So it's very important that people do seek medical attention, do seek medical advice to obviously get prescribed if need be with this kind of medication. Is the medication hard? Does it have side effects which then bother you?
In the beginning it was. They also told me that.
Okay.
So it took some weeks before I got used to it.
Okay.
And then I have no problem at all.
I believe it's a spectrum of different ages as well. It doesn't affect just a certain age group, right? It starts, in fact, in your case, you were pretty
30s,
young.
yeah.
You were really young. I mean, in the 30s, usually, and like you said, you were very active and you had a good position. Why does it affect such a young age as well? I mean, it's like a kind of sickness that you associate with an older age somehow. It's like when you say, because you have like arthritis and pains, you associate it with the older age when you've worked all your life and like your body is telling you, hello, you've done enough. But this works in a different way.
It's not really related to wear and tear. It's usually the age group it starts between 30 to 50 years. It can affect any age really, but because it affects people because something would have happened, for example, a stress-related incident. This can happen at any age. Okay. And like any other condition, it can come out at any age.
Do you believe that it was because of the accident that you had? Do you believe that it came through there? Had you actually been in pain after the accident, physical pain, I mean, after the traffic accident?
Yeah, the first accident was, I was dead. They put me up to life again, so it was really a hard accident. Okay. My car was totally squeezed together. Like a harmonica or something like that.
Okay.
So that was a bad condition. I did hit my head in the...
As well?
Yes. And
how old were you when this happened?
I was 25.
So this started happening 10 years later, approximately, these pains and aches and...
Yes. And I was very vivid and alive and did things. And
you probably made up for it.
It was like this, like living two lives at the same time. And suddenly it was stopped and I was like, what's happening here?
But it wasn't something which happened the day after. Like
No.
It was a gradual process,
yes.
Right? You start. It's not something which happens. You wake up in the morning and you say, "Ouch, I'm in pain."
No.
It's a gradual process which. Okay. Andrew, konna ħanibdew naraw xi ritratti biex anke nkunu nistgħu biex minn ma jafx dwarha jkun jista' jifhem aħjar. Kellna ritratt li jurik fejn l-uġieħ l-iktar li jkun, mhux hekk naħseb dak ir-ritratt li jekk forsi r-reġija tista' terġa' tellagħna dan
il-diagnosis jagħmluha meta jħossu daw il-points fil-ġisem u jaraw li pereżempju hemm ċertu numru ta' points illi it-tabib jista' iweġġa il-pazjenta billi jafas dawk il-points, ikunu tender points ngħidulhom. U jekk pereżempju jinnaf imiss ċertu points u jinnaf jaqqat ċertu numru ta' points, ifisser li dik il-persuna għandha dik il-kondizzjoni. Hawnhekk qed naraw li il-points qegħdin fuq il-ġisem kollu, ġifieri.
Dawra kollha, sax ma tantx baqa' postijiet fejn m'għandekx u xejn. Postijiet li bla ma trid tużomm matul il-ġurnata, jekk tqum bil-qiegħda, jekk tqum bil-wifq, jekk tqum fis-sodda, ġifieri huma postijiet li.
U bħala management tal-kundizzjoni apparti li hemm il-pinnoli li jistgħu ovvjament jgħinu biex inaqsu l-uġieħ, hemm anki ċertu lifestyle changes ukoll u ċertu terapiji li huma ma jinvolvux mediċini, pereżempju massage therapy jgħin biex jimmassaġġawlhom il-points li jkunu tender, jistgħu jekk ikun hemm pereżempju xi tensjoni fil-muskoli isir ċertu manipulation li inaqqas it-tensjoni fil-muskoli, l-irqat ġieli hemm ċertu persuni li batu b'dil kundizzjoni li jkunu neqsin mill-irqat.
Allura, ġabi, like Christina was saying, because you find it hard to sleep, so you sleep less, and then obviously you have, once again, a vicious circle of lack of sleep, fatigue, lack of sleep, fatigue, yeah, so.
And sometimes they would need sleeping pills to help them sleep.
Okay.
To
overcome that obstacles,
also avoiding, for example, cold weather, which can trigger off the pain.
So you're quite safe in Malta, Christina?
Actually, it's better on Malta.
It's better.
I try to be here in the spring and have a little bit of
But it's quite humid. It doesn't affect you, the fact that our country is quite humid?
No, not in that way. Because,
not in that way. Okay. It's the cold which affects you?
Yes, we can have very cold. It can be 25 minus in the area. And then I have asthma also, so it's hard to breathe. So I have to...
Does it perhaps mean, because Christina just mentioned asthma, does this condition trigger off other conditions? Does it make you perhaps more susceptible to other conditions like asthma, like, I don't know, diabetes, like, you know, does it make you weaker? Does it put down your immune system?
No.
No.
It has nothing to do with the immune system.
Yeah.
What it can perhaps trigger off is a depression, because obviously being limited, being in pain from morning till night, that would make the person feel depressed, and that can trigger off a depression which may need medication, as well as the medication for fibromyalgia, which is a different condition, but they can occur in the same person.
What about different foods? Is there some kind of food which helps or which hinders or which aggravates the situation? I know a friend of mine yesterday was mentioning that when his mother eats red meat, it gets very, very badly aggravated, the situation. She gets a very bad attack, she's much worse. So I guess it depends on the particular person, on the individual.
Yes, I think, but I eat extremely healthy. Okay. I eat ecological food.
Okay.
And we have fresh deliveries every week to our door.
Okay. Like organic, you mean? Like
yes, organic food.
Okay.
And we eat a lot of bird and game and fish. So we don't eat so much red meat. So it's hard to say that, but we eat very healthy, and I cook every meal and things.
Fil-fatt, here we have a picture of like getting the balance right, as with everyone, I think. This is important, Andrew, right? I mean,
with every condition and every living well means that you have to eat well if you want to live well, because if you don't eat well, you're bound to get something. I mean, if you eat fatty foods, you're going to get high cholesterol and heart disease. If you eat sugary foods, you get overweight and you develop diabetes. So eating right is always good for every condition.
And whenever you come, Andrew, you're always mentioning the fact that we need to do exercise.
And
you haven't met... I wasn't looking well. Because you always... Well. Every time he comes, it's like, don't smoke, eat healthy, and exercise. It's like his logo, I think. It's like his second name. Yeah, exactly. What about you? Do you find it easy to exercise in a situation like that? Does it help you to exercise?
It is painful, because every time you make these machines, you try to squeeze, you feel like you have 1 kilo, and it's a hard thing to do. You feel very silly because all the men are pumping up their muscles, and I sit there with 1 kilo and think that's a big effort. I feel better when I'm training, but it's very limited. It's bicycling and it's a little bit rowing, and I got up in weight so much all the time, and especially now I've just been 50, and I feel a bit sad that I lost, because I was very, very thin. And then I got a lot of medicine, and of course some of the medication has side effects.
And if you can't do that much exercise, it doesn't help, because obviously it's one.
I can't run because the feet's burning me. Because I walk with a stick, and I can't do too much. I have to do a little. So it's 30 minutes trying to do something at least. But
it's an awful condition. It's an awful condition, especially since it's not that recognized yet as well. So. Are there any, I don't know, experiments going on to improve this kind.
Yes,
I mean,
always.
like Christina was told, it's good news, I know what you have. It's bad news, you have to live with it. Is there a possibility that in the coming years, we won't be hearing that verdict?
It's a very complicated condition, and to find a solution or a cure for it, I feel it's quite difficult. But nothing is impossible. I mean, the future, they're always researching and new things are happening, and nothing is impossible. There might eventually one day be a solution and a complete cure to it, maybe.
Is there
You never
anything
know.
herbally that could be used? I don't know, like lavender oil and chamomile oil. Do these things help at all, or not really?
I tried with lavender to have it to inhale it in a room with a light or something like that, but it's not really. I have very hard to relax, actually.
Okay.
And I think the muscles are a little bit on the edge all the time, working, even if I try to...
Even if you're trying to
Yes.
relax, you're still tense.
Yes.
They're still... Okay, so that's tiring in itself as well.
Yeah.
You see, now, we're about to conclude, and I'd like you to obviously look at the camera, which is focused on you, and like pass this message that, you know, if you look for the answers, you might find the answers, and your life, obviously, you can tell it better than I can, that there is a way, and you can be believed that you actually have something.
Yes, and it's very also important to be positive. I have a very positive attitude as a person, and I hope for the best, and I do my best, and I'm surrounded by good people, and if you are a happy person, it's much easier. And don't be afraid to go to the doctor and be on it, nag on them to help you, because there is always a doctor that understands. Change doctor if it's necessary,
Yes,
but
exactly.
there is a help to get. But
Well done, well done. Thank you, and thank you for coming, Dr. Andrew. Thank you tal-li ġejt, tal-li naf li għamilt sforz anka biex il-sujġett tkun tafu sew, u anka tal-li sibtilna li Christina. I'm thanking him for getting you as well, you know, because it was a joint effort on his behalf, and I appreciate a lot. You know, people, when you see someone, it's one thing seeing the doctor talking about it, because it's clinical view from a doctor's point of view, but when you see a human who's going through the same feelings like you are, then you can identify. And like what you did today, I'm sure you helped a lot of people out there. Thank you very much, I really appreciate. Dottore, nirringrazzjak.
Thank you.
Nħallik tkompli mal-klijenti li qed jistennewk, però grazzi mill-qalb ta' din l-intervista. Għandna waqfa qasira nkomplu minn hawn ftit ieħor.